Where did you go? Who helped you set it up? How do you know how to get back there again? And if I wanted to go, who would I contact? And that goes in my folder, because I happen to work with the UNA. I've been president of that for the last 3 years, and so that's how we got in Jamaica. We went to Jamaica last year, and we went to the DR last year.
What about licensure and all that stuff? What do you, or getting past customs and all that stuff?
The very best thing that you want to do is keep your license. If you don't have it, yeah, you can go to certain places. Sometimes they'll ask you.
He's talking about getting the license in that country.
Well, license in that country, most of the time, you go to Tonga, you'll go to the hospital and they'll give you a temporary license. You have to send everything down to them, and you'll go down to the hospital, and Tonga will fix you up with a temporary license. I don't know if we paid anything. I don't believe we do. Samoa is going to cost you a couple $100 to go there. But Guatemala, you know what about Guatemala? You send down ahead of time. The Dominican Republic, I've never been quizzed. I don't know anything about that. Getting through customs, contact usually the Minister of Health or Ministry of Health and say, we're coming to do a humanitarian project. We're going to be bringing some medical. Some don't relate to dental equipment. We're bringing medical equipment. They all stand, oh, medical, yeah, we understand that. We're bringing medical equipment into the country, and a lot of medical medicines and supplies. What do we need to get in? And we, most of the time, will send them a letter with everything we're bringing, including 500 toothbrushes and toothpaste. Because we're not bringing it to sell, we're bringing it to give. And that's on our list, and they'll look at the list, and most of the time they won't open your bag, they'll let you on in. Yes?
Make sure everything's current, because if it's out of date, you're in deep trouble.
Right, similar kind of thing. If they want to look at it and see it, it's gone. But most of the time, they just look at my list, and that's all they need.
Most of the time, you'll just push the light, and you get a green light, and they don't even look at anything. But
yeah. The other thing that I tried this time, and I got it because of an individual that went to Guatemala this year, and on the side of the unit, when it came back, he said, medical, dental equipment and supplies going to a humanitarian project in Guatemala. And I said, how come you got that on there? And he says, 2 reasons. Sometimes the airlines looks at that and they feel sorry for us, and they'll let us go a little bit cheaper, or even let the second bag fly free. But he says the other thing, when they get to the security of the customs, they look at that and they say, oh, this is what it is. Have you ever watched them go through your bag? They want to know what the hoses are. They want to know what all the little fittings are. Is this something that's going to blow up? But now there's a slip here. It says medical, dental, surgical equipment going to, and it really gets us through there. They may open up one, but not all 6 suitcases, and lay everything out on the table. And I packed it so tight, because this weighs 30-some pounds, and I want to take 50 pounds, because that's what the airlines will let me take. So it's packed tight. And then to try to get all that back in there and get a strap around it and get it on its way doesn't work. But the slip worked pretty good when we went into the DR this time. We took 6 units and 5 other suitcases.
Dave Pulsford puts big red cross on a white background and then puts humanitarian supplies, and that works well.
Great idea. Great idea. Questions? Thank you.
Okay, thank you. Yes, I need to move.
Lawrence and Tom have been in Mali. How many times? 4? And they've got a PowerPoint they're going to present.
You want to do Glenn first?
Oh, I'm sorry. I'm sorry. I told Len I apologize, Len. He's behind me. Okay. And he's, well, I mentioned earlier, he's been in the Dominican Republic 14 times, Samoa 3? 2. And tell them the rest of the places.
Well, I actually took one of these units to Bulgaria a few years back and had a great time over there. First, let me say it's an honor to be here, and I want to talk just a little bit about my trip, or my organization, and also what it takes to start an organization. Some of you may be interested in that. Incidentally, these are the units that I brought. We use the Aseptico units. There's two types here. One's a pneumatic and one's an electric. There's advantages and disadvantages to both those, and I'll be happy to talk with anybody afterwards more about that. But let me just go right into my PowerPoint presentation, so we have some time left over at the end here. I think it's this right here. And I'm going to turn these lights down so you can see a little bit. Is that okay for everybody to see? If I can find the pointer now. My organization was started formally back in about 2004 by myself and another dentist. We kind of do things a little differently. We take mostly dental students with us and give them an opportunity to do most of the work under the mentoring of dentists. And we currently run about 2 or 3 trips a year to different parts of the world, but we focus primarily on the Dominican Republic just because we've been able to make some incredible contacts down there. When you're starting up an organization, there's some things that I think are very critical that you need to do. One is you need to define what you're going to do. If you're going to just go once or if you're going to go back many times, it makes a big difference. Doing your homework, as we heard earlier, having people on the ground to get some of the work done for you. I've always felt that if I'm going to ask somebody to come over and work on a humanitarian project and take a week off of work and pay their own way, I'd better have things prepared for them so they're not standing around waiting for things to happen. One of the things that, if you're going to do this on a long-term basis, is I would recommend that you form a nonprofit corporation through the state and then apply for 501c3 tax exempt status through the IRS. You can get a CPA to help you with the 501c3 tax status, and an attorney can help you set up a nonprofit corporation. That can take quite a while to accomplish that, but there are some real benefits. You can get people to donate money to your cause. They're more willing to do that if they can have a tax write-off for that. Then you need to determine where you're going to go. Are you going to go to many different places, or are you going to go to one location? If you're going to go to one location, it's a little bit easier because you can have people on the ground helping you when you come back. The other thing I think you need to decide is who you want to take. Do you want to just take dentists? Do you want to take students? Do you want to take auxiliaries? I think if you kind of define that, it makes it a little bit easier for you. Then the one thing that's really important, we talked about it a moment ago, is obtaining proper approval. I've been to places where you can actually have your equipment confiscated or even be arrested if you're practicing without permission. And permission can be obtained a lot of different ways, but preferably from a government agency. And you can do that by contacting the government, the oral health minister, or maybe some other Ministry of Health to get written permission. And take that permission with you. Request a copy of the permission. And when you do get to the airport, if you do go through customs and have a problem, you can always whip out that permission slip and show them that you're here by the permission of the government. In addition to all the other things that we talked about, you know, putting humanitarian on your bags and stuff. The other thing I would recommend is it's so important to work with local contacts. They can do most of the groundwork for you, and they can have things ready for you when you get there. They can solve problems for you when you're there. And one thing that a lot of humanitarian groups don't do, and that is they don't provide follow-up treatment for patients who may have problems. If you have someone who has a severe infection, dry socket, it's a good idea to have some contacts to refer these people to some local people to be taken care of. One thing I would also recommend is understand and know the customs of the country you're going to and what the standard of care is there. We went to Bulgaria, and worked in an orphanage and tried to give the kids anesthetic, and they just do not usually give anesthetic over there.